Hi guys. Actually, tomorrow I have a anatomy exam, final exam, about the 12 cranial nerves, 12 pairs of cranial nerves. So I actually studied them, but I made some few points in order to revise them before the exam in general. Not that general, I might revise some specific stuff. So I made that video to make some points in order if you want to revise these cranial nerves you can revise them very fast according to these points, but you might not revise specific things. Okay, let's start. Our points will be based off the number of nerves, type of each nerve, location of each nerve, name and the number of nuclei of each nerve, name the exit pathway that each nerve has to take in order to escape from the cranial cavity, how many ganglia each nerve does has, and the function of each nerve. Let's start with the first point, which is the number of each, numbering the nerves. So let's number them. First of all, we have optic. Second of all, we have first of all we have olfactory. Second of all, we have optic. Third of all, we have oculomotor. The fourth is trochlea. Fifth is trigeminal. Sixth is abducent. Seventh is fascia. Eighth is vestibulocochlear. Nine is glossopharyngeal. 10 is vagus. 11 is accessory nerve, and the 12th and the last pair is the hypoglossal nerve. So we should take now the first point. We're done from it. Numbering the nerves in order. Let's go to the next point. Type of each nerve. Olfactory nerve actually is sensory. Optic nerve is sensory. Oculomotor is motor. Trochlear is motor. Trigeminal is mixed. Abducent is motor. Vestibulocochlear is sensory. Glossopharyngeal is motor. No, sorry, glossopharyngeal actually it's mixed. Glossopharyngeal is mixed. Vagus is mixed. Accessory is mixed. Hypoglossal is motor. Take the second point. We're done from the type of each nerve. Location. The first one, which is the olfactory, location in the inferior side of the brain, and to be much specific, after going from the foramen of the ethmoidal foramens, it goes to the olfactory bulb. In this part. Now, to the optic nerve also in the inferior part of the brain, and to be more specific, at the optic chiasma area. Oculomotor actually it originates from the medial side of each cerebral peduncle. Okay, oculomotor, then trochlea. It's located surrounding the cerebral peduncles, looping around them. Trigeminal nerve, it is located inside the cranium. It escapes through different foramens inside the skull, and the trigeminal originates from the lateral sides of the cerebral peduncles. Now, abducent nerve. Yes, it from the medulla pontine, from the interior part between the pyramids and the anterior sulcus. Then we have the facial, which will be lateral to it, and then vestibulocochlear, which will be also lateral to it. Now, glossopharyngeal nerve will be on the posterior lateral side of the medulla oblongata. Vagus and accessory also they will be at the posterior lateral side of the medulla oblongata. Hypoglossal nerve will be at the anterior lateral side of the medulla oblongata. So we finished the third part, which is the location. go to the name and the number of each nuclei of each nerve. Okay. Olfactory and the optic nerve, they don't have nucleus. Okay. Aculomotor. Aculomotor has two nucleus. It has accessory for parasympathetic and it has normal motor nucleus. So it has two nucleus, parasympathetic and motor. Aculomotor. Trochlear. It has one motor nucleus called trochlear motor nucleus. And trigeminal nerve. Trigeminal nerve actually has three sensory nuclei. One is called mesencephalon nuclei, the other is called principal sensory nuclei, and the third one is called spinal sensory nuclei. And it has the fourth one is motor. And and to be in giving general idea about the trigeminal nerve, it has four nuclei, three sensory and one motor. Now, abducent nerve. It has one nuclei, which is motor nucleus. Vestibulocochlear nerve. Vestibulocochlear nerve, actually, it's a sensory nerve, and it has five sensory nuclei for the vestibular nerve, and two nuclei for the cochlear nerve. And as we know, for the vestibulocochlear nerve, these two nerves comes touching to their nuclei, making the trunk of the vestibulocochlear nerve. Now, glossopharyngeal. Glossopharyngeal has three nuclei. It has the umbgus for the motor, which is the motor. It has the salivatory for the parasympathetic nerves, and it has the salivatory tract nucleus for the sensory. And then we have the vagus nerve, which has also three nuclei. It has umbgus for the motor nucleus, and it has also salivatory tract for the sensory nucleus, and it has the dorsal nucleus for the parasympathetic fibers. Now, let's go to the accessory. Accessory has two nuclei, and they are motor. One called the accessory nuclei, and the other called just umbgus nuclei, and it's also motor. So two nuclei for accessory. Hypoglossal has just one nuclei called hypoglossal motor nuclei, and as we know, hypoglossal is motor for the muscles of the tongue. Now, we finished this section of naming and numbering the nuclei of each nerve. Now, let's go to the fifth section, which is naming the exit pathways for each nerve. As we know, each nerve has its own exit pathway in order to escape from the cranial cavity. So, let's start. Olfactory nerve, it just skips from the ethmoidal foramen on the cribriform plate of the ethmoidal bone, and for sure we all know where is it. And optic nerve from the optic canal for sure, oculomotor from the superior orbital fissure, trochlear nerve also from the superior orbital fissure, trigeminal nerve. Trigeminal nerve has three branches. One branch is from the skips through the superior orbital fissure. The second branch skips from the rotundum foramen. The third branch skips from the ovale foramen. And to be more specific about the trigeminal, the first branch that skips through the superior orbital fissure, actually called ophthalmic. The second one that skips through the rotundum foramen, called maxillary nerve, and the third one that skips through the ovale, called mandibular nerve. Now, abducent nerve also skips from the superior orbital fissure, and facial and vestibulocochlear nerves, these both two nerves, escapes from the internal acousticus meatus of the petrosal part, and for sure we all know where this part is located. Now, glossopharyngeal nerve, vagus nerve, accessory nerve, these three nerves, which is 9, 10, and 11, they escape through the jugular foramen. And the 12th nerve, which is the last nerve, which is hypoglossal, it escapes through the hypoglossal canal, for sure. So we're done from the exits. Let's go to how many ganglia for each nerve? Olfactory don't have, optic don't have, oculomotor don't have, trochlear don't have, trigeminal don't have. No, sorry, trigeminal does have. It have actually uh, 1, 2, 3, 4. 4 ganglion. One is the ciliary ganglia for the ophthalmic part, and the other one is the otic ganglia for the mandibular part, and the third one is the zygomatic communicating. Sorry, pterygopetrosal ganglia, and the fourth one also for the mandibular part, which is submandibular ganglia. So we have 4 nuclei: ciliary ganglia, which is for the ophthalmic, and for the maxillary part is pterygopetrosal ganglia, and for the mandibular part we have 2. We have otic and we have submandibular ganglia. About the facial nerve, doesn't have, abducent doesn't have, vestibulocochlear doesn't have, glossopharyngeal and vagus they both have. Each of them has two ganglia, superior and inferior. So glossopharyngeal has superior ganglia, which is located at the jugular foramen, and inferior ganglia, which is located beneath the jugular foramen. And vagus has also two ganglia. One is at the jugular foramen level, and the other one inferior to below the jugular foramen. Accessory doesn't have, hypoglossal doesn't have. And let's talk about the function. Actually, I don't think we should go through the function part, because we know the function of each nerve according to their name. Olfactory for olfaction, for smelling; optic for vision; oculomotor for moving the muscles of the eyes; trochlear also for special parts; trigeminal for the let's say trigeminal for the parotid, for the salivary glands, for the facial nerves here, supraorbital and supratrochlear, and innervating, in general, innervating the whole face, sensory innervation for the whole face. Yes, abducent for abduction, for the lateral rectus muscle for the eye; facial for facial impressions; vestibulocochlear just for sense and hearing; glossopharyngeal for innervating of the pharynx and the mucosa of the posterior third of mucosa of the tongue, and the soft palatine, and these areas, and the tonsils also, palatine tonsils. Vagus nerves and accessory nerves and the hypoglossal nerve. Each one has its own specific function according to its name. It's not that hard. Thank you for seeing my video, and I hope it would help.